Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy. So today we are going to learn about introduction of novel transdermal route of drug administration. This topic is content beyond syllabus. So we will see in brief about novel transdermal routes. Outcome of this lecture: students will be able to analyze the novel transdermal route of drug administration. Second, students will be able to explain the various novel transdermal route of drug administration. The list of transdermal route is: first one is hypodermoclysis, second one is hypospray or jet injection, third one is implants, fourth one is iontophoresis, fifth one is inunction, and sixth one is adhesive units. So we will see one by one the various routes. In the first route, that is hypodermoclysis, you can see here we are introducing the drug in the loose connective tissue, that is also called as subcutaneous layer. Here we are injecting a large amount of drug by this subcutaneous layer. Normally we prefer intravenous route for injecting large doses of drugs. Hypodermoclysis, this is a special process of injecting large amount of drug through the loose subcutaneous tissue of the body. The best sites are thighs and buttocks. This method is useful in conditions where vein puncture is difficult. Example like pediatric practice, normal saline solution is given by this route. Or in burning cases where the veins get damaged, we can prefer this route for introduction of large number of proteins, etc. Hence, in this technique, we inject drug in large amount in subcutaneous layers. Normally, we inject very less amount of drug through subcutaneous tissue. Next is hypospray or jet injection. So you can see the image of that jet injector. So in this technique, you will be able to see in the image. So in injection method, we use a needle to press the body and introduce the drug. So as we can see here. But in jet injection, we inject the drug with high pressure, high velocity from a small minute orifice or pore that will be matching to our skin pores or holes, so that without the help of needle the drug will introduce into the tissue. Normally we introduce the drug in subcutaneous layer. So in this method there will be no pain, as we are not using the needle, we are using the normal hole which is present in our skin. So this method involves subcutaneous introduction of a drug by means of high velocity jets projected through a fine orifice. As this method is devoid of needles, thus avoids pain during injection. This method is useful for mass inoculation program. Commonly hypospray is also called as jet injection. So we will see an animation of jet injection.
Medical professionals exist in a bubble where it's sometimes easy to forget the real anxiety that patients have for needles. It can cause a real roadblock to effective care. There's a company trying to solve this problem, Ajax Pharma International. Speaking to Esvar, he is responsible for a new solution to solve this age-old problem. Esvar, explain a little bit about the product.
Injects 50 is a needle-free injector which works on air pressure. It's a spring-loaded device. The moment you compress the spring and release it with the medication, the drug goes under high pressure within the skin. And this is strictly for subcutaneous use and not used for intramuscular or intravenous applications.
And please, for us, explain exactly how the process works.
See, normally this is mainly used for patients who are on insulin, who are on growth hormones. It's also used for dental anesthesia, for the face, etc. So I'll just explain to you, for example, if the patient is taking insulin from an insulin vial, okay, we provide a vial adapter. If they are taking from an insulin pen, we provide a pen adapter. If they are taking it normally from a glass ampule, we provide a lure adapter. So we have 4 type of adapters that we have for this. And I'm taking the medication from the vial adapter. I'm taking it inside, and you can see medication inside this. Every time before this has to be used, you have to compress the spring using the reset box. It has to be placed inside this. Close it, take it out. Now it's ready for use. Now I place the ampule firmly over here. We provide a safety mechanism here to avoid accidental shots while you are loading the ampule. So release the safety mechanism, holding it at 90 degrees angle towards the body, okay, with a slight pressure, just pressure. So it goes within a fraction of a second, the drug is delivered inside.
Outside the practitioner, of course, who benefits from the technology?
Mainly, this is beneficial to those patients who have a fear for the needles. Needle phobia, as almost 10% of the population have a fear for needles. And also, it's mainly used for patients who are on long-term medications like insulin, growth hormones, interferon, patients who are.
This was about Hyspro spray or jet injection. So you can see in images. Just we are seeing the animation of insu jet. Next is implants. As the name indicates, we will plant the drug in our skin. That means the advantage of sustained and slow action of drugs produced by subcutaneous injection is utilized in sustained release preparations in the form of implants. Implants are nothing but they are depots of drug. So these implants may be effective substitutes for repeated injection, which can last for a period of about 9 to 15 months. So you can see here that is pellet implantation. So how it works, these are the implants which are placed below the skin. You can see here. So these are the implant needles which are placed inside the skin. It is for 5 years. Levonorgestrel, that is a contraceptive implants which works for 5 years. So this is the method by which we introduce the implants. So in short, implants are depots of drug which are kept under the skin, that is in subcutaneous layer, from where it slowly releases the drug for a long period and avoids repeated administration or injection of drug. Next is iontophoresis. In this method, so we use galvanic current for the penetration of drug applied to the skin into the deeper tissue. So you can see here. So because same charges repel, what we will do, we will apply the drug on the skin, then we will apply the current, same current, that is positive charge. Because of positive charge, same charges repels and drug will goes into the skin and reaches the blood circulation and show its action. So you can see here this apparatus will consist of a positive ion and a negative ion. The drug introduced will be in a positive charge form. So when we apply the current, the same charges will repel and the drug will enter into the skin. So as we are seen here in the diagram, so the drug will goes into the blood circulation. In this method we doesn't need any type of needles, or we doesn't require any types of instruments to introduce in the skin. Like in implants we have to preach and place the drug, or like for anaphoresis, that is method, we avoid of any such needles, etc. So anode anaphoresis is used for compounds bearing positive charge, and cathode anaphoresis for the negative charge compounds. The force of repulsion between similar charges drives the drug into the deeper tissues. Example is salicylates have been used by this method. That is, you can see here the apparatus which is placed on the skin. So the mechanism of second apparatus, we have the drug and will apply the charge. Same charge will repel and the drug will penetrates into the skin and reaches the blood circulation. Next method is inunction. So you can see the image of an inunction method. So that is simply rubbing of the drug upon skin. So certain drugs when rubbed into the skin, that is inunction, can get absorbed and produce systemic effects. Example is nitroglycerin ointment in angina pectoris. Certain potent glucocorticoids when applied to skin lesions for local effects may get absorbed and cause systemic adverse effects. So normally inunction means simply we'll place the drug on our skin and we'll rub it. Because of that rubbing action, it goes into the deeper parts of our body and show its action. So and the last is adhesive units. These are simple like bandages. So you can see here, this is the adhesive unit which are applied onto the skin. So a transdermal therapy system in the form of adhesive unit is available to deliver drugs slowly, producing prolonged systemic effect. Example is scopolamine for prevention of motion sickness. Similarly, drug estradiol TIS is a self-adhesive, releasing predetermined quantities of estradiol per 24 hours for a period of 3 to 4 days. So in this method, we will make a bandage or adhesive tape or adhesive unit of the drug and will simply apply onto the skin, and which shows a prolonged action. So what we have learned? We have learned the new transdermal drug delivery systems like iontophoresis, implants, adhesive units, jet injection, hypodermoclysis, etc. Thank you. And the next topic is 2.6, that is first pass metabolism of drugs. So first pass means when the drug goes in the first time and leads to metabolism of drug, that is called first pass metabolism of drug. Students will be able to explain the first pass metabolism. What is first pass metabolism? What happened now? Whenever we take the drug, it goes into the stomach, small intestine, etc., and get absorbed into the veins. You can see here all the veins will first enters into the liver with the help of hepatic portal vein. So because it goes first time to the liver, we call it as first pass. In liver, we know that maximum drugs get metabolized or degraded or break down. Okay, so that's why when the drug reaches the liver first time and get degraded, we call it as first pass metabolism. The first part effect is a term used for the hepatic metabolism of a pharmacological agent when it is absorbed from the gut and delivered to the liver via the portal circulation. The greater the first pass effect, the lesser the agent will reach the systemic circulation when the agent is administered orally. So the first pass metabolism will be seen only in case of oral administration of drug, and the drug should get absorbed into the portal vein. So you can see here, so small intestine, large intestine, stomach, all the drug which get absorbed goes into the portal vein, that is called hepatic portal vein, and goes to the liver. The amount which gets metabolized by the liver is called first pass metabolism. So you can see the image. So what we have learned, first pass metabolism is when the drug get absorbed from stomach, small intestine, goes to the liver by the help of hepatic portal vein, and in liver it get metabolized. So this effect, that is first time when it reaches the liver and get the amount of the drug which is get metabolized, is called as first pass metabolism. Thank you. Thanks a lot.